My name is Tony Michaels. I'm with Therapy Partners in North Texas, and we're going to talk a little bit about labrum tears in your shoulder. Got a simple shoulder model here. What you can see is you have your arm bone, you have your collarbone, and you have your shoulder blade. The labrum is connective tissue on the inside right here of your shoulder blade that almost forms a cup and helps hold your arm bone in place. We can do things that can create a tear in your labrum. A lot of times these things are falls under an outstretched arm, forces that would cause the arm bone to kind of move out of joint, if you would. A simple dive back into first base if you're a baseball player, or an arm tackle with a football player. But it can also be as simple as falling onto an outstretched hand. Small tears in your labrum, in the right place, can be treated with conservative care, physical therapy. That conservative care is going to focus on restoring your motion, correcting your mechanics, and strengthening your rotator cuff and your scapular stabilizers. Now, your rotator cuff is four muscles that kind of surround the ball on the arm bone, and really their job is to help keep the arm bone in place as it moves through its various motions. Your scapular stabilizers are muscle groups that attach your shoulder blade to your spine and your rib cage and help ensure that that moves correctly as it moves around your rib cage. Now, labral tears can be significant. Ultimately could lead to a surgeon repairing your labrum. If that's the case, it's highly recommended that you get with a physical therapist in your community and have that therapist work with that surgeon to get you back to life. So what I mean by that is we want to get you back to living and doing all the things that you were doing before. So early on, following surgery, the treatment's going to focus on pain control, gentle movements to allow your shoulder to get a little motion, but also really the goal is to protect that surgery so that it can heal. And then as your program progresses, you're going to ultimately work on getting your arm back over your head, over to the side, and again it's going to accumulate really with a lot of rotator cuff strengthening, scapular stabilizing strengthening, and again the focus is going to be on getting you back to those activities that you love to do. Just because you have a labral tear, it doesn't mean that you are no longer going to be able to throw that baseball. It doesn't mean that you're going to no longer be able to lift overhead. Following a significant labral tear, surgeons and PTs work hand in hand and can really help work you through that whole recovery process. Again, I'm Tony with Therapy Partners in North Texas. I really hope this video helps you a little bit with that labral tear, and good luck.